afternoon, everyone. My name is Dr. Marshall, but feel free to call me Jada. I am an immunologist, which means I am a specialized medical doctor trained in managing problems related to the immune system. Within this profession, we like to use a study often referred to as immunology. Immunology is a very important branch of medical and biological sciences. If the immune system isn't working properly, diseases can form, such as autoimmunity, where your healthy cells and tissues attack the body itself, allergies, and cancer. Wow, look at the time. It went by so fast. I'm going to be late meeting my next patient. They seem to be dealing with acute lymphoblast leukemia. So let's just go see how they're doing.
Oh, doctor, my medication, it's not working. I need something more, something stronger. How long does she have?
I can't keep doing this.
Mama, sit down.
Every day. Okay, I'll have a seat. Every day, it's just something new. Father, he would have never been proud. We don't have cancer in our genes. How the fuck does she get cancer?
Okay, I hear you. And I want to address your concerns. So what I'm going to do is I'm going to prescribe you with a new drug. It's called Mercaptopurine. It's an immunosuppressant, and what it does is it stops the spread and growth of cancer cells. And I think with your type of cancer, this medication will be really effective for you.
So, what are the side effects?
Side effects include being at a higher risk of infection, bleeding, lower blood count, dizziness, temporary hair loss, darkened skin color, nausea, vomiting, along with many others.
Really?
I can't live like that.
She's gonna go bald before prom.
Now, that type of hair loss is unlikely. You won't go bald unless you completely shave your hair. But I would just like to give you some more information about this drug if that's okay with you. When looking at the molecular structure of mercaptopurine, it has a total of 4 pi and 15 sigma bonds. Mercaptopurine is a very complex molecule that consists of 5 carbons, 6 hydrogens, 4 nitrogens, and 1 oxygen and sulfur atom. This molecule is used as an immunosuppressant drug, which suppresses the strength of the immune system, an anti-metabolic drug, which interferes with metabolic function in the immune system, and an anti-neoplastic drug, which is an anti-cancer molecule, or in other words, a type of medication that's taken to help treat cancer. When looking at the molecular structure of mercaptopurine, you can tell that this molecule is polar with respect to the surrounding polar atoms of hydrogen. This is because in a molecule, you can have a bond that's polar in one direction, but different in another. But if you have the same thing on each side, they cancel out. If you have an asymmetrical shape, then the polar bonds will make it polar. Basically, it can be said that mercaptopurine is polar with respect to the sulfur and hydrogen atom.
Instead of taking this new drug, chemo, we would love to take this new drug called what, doctor?
Mercaptopurine.
Mercaptopurine. I'm sorry, I'm still craving.
Mom, I'm right here.
It's okay.
Who are you grieving? The grilled cheese you just ate.
Because I know you're gonna die.
Or am I?
You're what?
I'm not dying, Mom. This is all a prank.
Well, it looks like my job here is done. Till next time, when I have to prescribe medication to a person who isn't being pranked. Bye.